All right, do you want to tell me a little bit about yourself, your background, and a little bit about how you came into Cosmos?
Yeah, of course. My background. I guess it's a little bit lengthy, but I can just start. I did my cardiology fellowship training back home in Canada, and then after doing that, I ended up training further in interventional cardiology, and I also did a fellowship in critical care cardiology. So the purpose of that, or my goal behind that, really was to spend my time kind of split between the cardiac cath lab and the cardiac ICU or the CCU. So that's kind of my clinical background. Now, as I was involved in my training, my research interests really were kind of geared towards these types of patients. The ones that we see in the cath lab and the ones that we see in the CCU, which are oftentimes the most sick cardiac patients that we get. And as part of that, I found that we were spending a lot of time when I was evaluating patients, whether it was the middle of the day or the middle of the night, using handheld bedside echocardiography. So we had a few different machines in my training program that we used, and I got familiar with a couple of them. And then I ended up doing a couple research projects trying to really assess the accuracy of these devices. In particular, how accurate are they compared to the formal, 2,000-pound machines that we have to lug around in terms of the image quality and the features. And then the other piece of it was how accurate are these machines in different people's hands. And what I quickly came to realize was that that's I guess pretty obvious, but that's the biggest barrier between expanding this technology outside of the hands of a cardiologist and into other people's hands is the reliability of the interpretation of the images. So as part of this, I ended up meeting the Kosmos team, and I learned about the product. And they came out to see us in Ottawa, where I was at the time, and they showed us some of the AI algorithms that they were working on, and kind of their vision for these handheld devices, which could really democratize bedside ultrasound, whether that's echocardiography or vascular ultrasound or what have you. So that was kind of the beginning of how I met Kosmos, or the Kosmos team. And then from there, I ended up getting access to one of their devices, which I brought with me to Boston when I was doing my my critical care fellowship training. And that's when we started to develop it. And the idea when they first gave it to us was to assess exactly what I was talking about, assess the accuracy. So we started with a very simple project, which we've finished enrolling patients in right now, and we're just working on data analysis. But the project was to just look at the automated ejection fraction algorithm that the Cosmos device has. Have fellows and anybody who would perform bedside echoes, have them use the device, get the automated ejection fraction, and then compare that to the formal ejection fraction on the transthoracic echocardiogram that was done. So that was the basic project that we came up with. So that was when I first started to use the device clinically. So I know I'm rambling a little bit, but that kind of tells you how I started to use it clinically. And then I'll tell you that, which I don't know if this is your next question, but my experience clinically with it was I actually feel like I gained more from it than I was expecting, because I came in with this very narrow kind of question we wanted to ask from a research standpoint. And then what I found was that as I was doing this as a critical care fellow, I'm constantly with internal medicine residents or other critical care fellows who weren't already trained in cardiology. So then I started to do it with them and to use it as a teaching tool. And then that's when I found that the automatic anatomy labeling really came in handy. It's a lot easier to have them just look at the screen and they can see, well, that's the LV, that's the RV, those are the valves, without having to point out everything. And then as the image changes, the anatomical locations change, and so does the labeling. And I thought that was very helpful from an educational standpoint.